Hello, everyone, and welcome. Thank you for joining us. We, as a city and a Board of Ed, thought it was a great opportunity for us to get together and have some conversations about what does it mean to return to the red zone and what does it mean to contact trace. These are all new vocabulary for some of us, and so we wanted just Stamford Public Schools in collaboration with the city of Stamford, that we would be able to really talk you through what this looks like as we are contact tracing in our schools, in our city, and what does it mean when we're getting additional cases around the city of Stamford and within the Stamford Public Schools. For those who don't know me, I'm Dr. Temu Lucero, Superintendent of Stamford Public Schools. And with me tonight, I have, you might recognize Mayor Martin, who will wave for those of you who don't recognize him. We also have with us Dr. Calder, who is the Director of Health for the City of Stamford. We have Dr. Yoon, who's our medical advisor. And we have Maura Bryson, who is our school nurse supervisor and has recently taken on this role during COVID. So we really appreciate the fact that all of them have joined us tonight. We really want this to be an informational session for everyone because everyone has to admit that we are all learning something new every day related to COVID-19. And so we really feel like taking this opportunity to talk not just to Stamford Public Schools, which we're hoping a lot of teachers and families are joining us today, but people around the city of Stamford. So at this point, I'm going to turn it over to Mayor Martin, who really is going to really talk us through a few slides related to what does it mean for us to be back in the red zone. And I will tell you that I really appreciate having a mayor who is so engaged in this work. Every Tuesday and Friday, I get to hear a presentation like this. And unlike maybe everyone else on the call that day, I really enjoy it because it really helps me do my best thinking about how it's safe for our students to remain in school. So I'll turn it over to you at this time, Mayor Martin, for your presentation.
Well, thank you very much, Superintendent Lucero. I thought you were going to say it because it was the one brief moment of the day on Tuesdays and Fridays where you weren't constantly being bombarded by everything that under the sun during this COVID crisis epidemic that we're in. In any event, I'm happy to be here and happy to help. And I'm going to explain first a little bit about what the case tracking that we're doing, and some of it is my own personal tracking that I do off the public website. There's some other stuff that we get off of dedicated websites, but basically it's showing a bunch of information that you will have some background about what's happening. And some of it's alarming and some of it is just, that's what it is. But I will run you through that. And then we'll talk about how the contact tracing actually helps us make decisions about what's going on in the schools in particular. So if you go to the next slide, please. So this is a chart that I get off the public website. I go there every day or every 2 days and pick up how many coronavirus cases there are in Stamford. And you'll notice on the very far left, there's a little line that says the April 7th exponential trend line. On April 7th, we didn't have that whole set of orange dots and all that. We only had a trend line at that point was going almost straight up. That is the exponential growth. And to give you a sense of that, our first case, I believe, was March 16th or so. Within 4 weeks, we had 1,000 cases in Stamford, and it would have, it just was going straight up at that point. If you hit the clicker for the next thing. So, but what you've seen is that we got off that exponential curve and we did what we call bending or flattening the curve. And you can see there how it was rising so rapidly and then started to turn over, and sort of it still was climbing, but not nearly at the same rate. And so that was good. And if you hit the last point, but now if you look at the very tail end of this, you see a yellow dashed line. That's kind of the trend line we were on all the way through June, August, September. But now, since roughly the 1st of October or mid-October, you can see the number of cases, the cumulative number of cases have been growing. That's caused us great concern and caused us to go into the red zone, which I'll show in a little bit more detail. So let's go to the next click. This chart has on it the number of new cases reported every day on the state's public website. And that orange line, or the blue line, the blue dashed line, is the 7-day moving average. Sometimes they don't get the weekend data right, or sometimes other problems occur. So a 7-day average is usually a better way to look at this rather than the individual days. The orange line is a 14-day moving average, and it's just basically a 2-week moving average. So if you hit the next click, and basically you can see what we saw before, which was that cumulative cases are getting higher on the chart on the left. Now when we look at new cases per day, it was floating down for the whole city of Stamford during the month of July and August. It was as low as 2.5 cases per day. But since mid-October, you can see how those lines are rising, and you can see how they're accelerating. They're growing rapidly, so that according to this public website, the new cases per day in all of Stamford have been roughly 35. Now that includes everything. That includes everybody who lives in the city of Stamford, including those who might be in nursing homes or assisted care, etc. And sometimes they make adjustments to these numbers based upon new data information. So this is just what comes off their website on a raw form. Next click, please. This is actually coming off a proprietary data set that the state has that gets us some additional information, which you'll see later. And you can see now on that chart on the bottom, that huge rise in cases that was happening in March and April, where we were getting up to almost 100 cases a day being added to the city of Stamford, and then dropping way down. But now it's been rising again, and it's up to 36. Now there's a little bit of an oddball thing in this data set, is that, and I won't get into all the technical details, but in the other chart, that's just what was added that day. In this chart, there might be additional cases that will be added for November 2nd or November 3rd or November 4th. And that's because it's the day that they made the test. And so it may be that it doesn't get reported till later, and it'll then get added back. So they're not even looking at the last few days. But you can see once again, it's climbing, and it's not as high as it was in the spring, and it's not going up as fast as it was in the spring. But it's definitely climbing, and I don't think we should give any credence to the fact that we've had some low cases here since the 1st of November. That data is yet to be updated. Next chart, please. This is, in fact, the state's look at this data, where I only have the 7-day moving average, which is the blue line, and the 14-day moving average, which is the red line. In fact, if you look at that red line, which was the day-to-day reporting, there on October 24th, I believe it was the magic date when they decide, what status is of every town. On October 17th, we were yellow. Norwalk had already gone red. Danbury had already gone red. And Hartford was, I think New London was red. And I think there were like 19 other communities that were red. And we were still yellow. So it goes, if you're less than 5 cases, it's nothing. If you're between 5 and 10 cases per day per 100,000, it is yellow, and we were at 8.5. If it's between 10 and 15, you become orange. And if you're over 15, you become red. You'll notice that that 14-day moving average, which is what they use, was actually a little bit below 15. I had estimated that we would be orange on that date, and I was already talking to the state about actions that we might want to take to deal with that. But they revised some of their data and on that very day, and as a result, the actual report was 15.6, and that put us in the red zone. I believe there are 39 other communities in the state that are also red, and that gave us the ability or the need to go back from a phase 3 reopening back to a phase 2. Now, what are phase 3 and phase 2 all about? Just before I go on to the next slide. Phase 3 is the governor's reopening plans. So restaurants could have 75% capacity in their restaurants. Hair salons and barbershops could have 75% capacity. And there's a whole series of rules that basically was allowing the economy to reopen. And with the rising number of cases, the governor has in fact rescinded phase 3, and we're now at phase 2.1. Basically, it's phase 2 with a couple of adjustments that have now started, and I believe that's for the entire state, but you can once again see how we're rising. Next chart, please. We also, and this is a little bit more technical, but we are also getting information about the coronavirus RNA that is in the wastewater that goes into the wastewater treatment plant, the WPCA. And so basically Yale University comes down and tests the sludge that it's the wastewater, and it's not dangerous there. By the time it gets to that point, it's not contagious or anything, but there are still remnants left of the strands of RNA that have no capability to hurt anybody, but they can still detect it and measure it. And you'll notice there that this starts in August. It was very, very flat and very low in August. We had a little spike there. I happened to see that spike when I was out of town, and we had a reverse 911 call. And I think that helped bring that down and bring the number of cases that were down. But now you see it's trending up. And seeing this data and seeing other data, I made a reverse 911 call where I called everybody and said, hey, we've got cases coming. Those red bars came after I made that 911 call. And you can see that they're indicating a almost doubling of the cases from what we had maybe a week ago. And this is an early warning indicator. It's saying in the future, you're likely to start seeing these number of cases. And so this is a real warning sign in terms of how high this has gone and how rapidly it has jumped here in just the last week. Now, hopefully, because we sent out the message and because we're moving back to phase 2.1, hopefully we can reverse this trend. Next page. We actually can track cases by their neighborhoods. And we've roughly broken the city of Stamford down into these neighborhoods, and we are now reporting it on a cases per 100,000 per day. And those areas there in North Stamford, Westover, Turner River, Newfield are all in the yellow zone. They're not even in the green zone below 5 cases a day. They're above 5 cases. They're 5 to 10. And then you see a number of orange areas, which are in the 10 to 15. And 10 to 15 is already an area where you need to be backing down, need to be doing something more aggressively. And you can see the number of red areas that we have on the chart. Over the past month, we've been watching this closely, and we've had a couple of surprises here and there. But in general, it is high density housing that is highly diverse and highly socioeconomically diverse. And so we've tended to have heavy cases on the west side, in the water side, in east side. The downtown doesn't have the same diversity of housing. So the downtown has typically been a little bit better, but in the last couple of months, it started to go more red. And the surprise on this chart is Japan has usually been yellow or orange, and in this chart, it's gone red. I will tell you that this is only the cases in the past 30 days, but just so that you're aware, at this level, there's only 600 cases, I think, in this chart. There can be statistical uncertainty. So some of these numbers can move higher or lower and change some of their numbers. But as you can see, we seriously have a coronavirus throughout all of Stamford. It's less north of the Merritt or just south of the Merritt, but even there, it is not in a green zone. There are cases that are going on. Next. The chart on the left is, as of, I believe, yesterday, the number of cases that have been reported from people who are in the elementary schools, whether it's a staff member or whether it's a student member, and same thing for the middle and high schools. And you can see that some schools have zeros, and the worst one in this whole list is West Hill with 11. And when you look at the elementary versus the high school, and you look at how many people are in the schools, you don't see a whole lot of difference. You see one's at 0.48%, one's at 0.49%. That's 0.48%. In other words, that's 1 for every 200 people is what that is. Those are low numbers, and there's not a whole lot of difference. You would expect with numbers this low that you would have some zeros and ones and twos, and you would expect some in 7, 8, 9s, 10s. So these numbers here are not surprising. They don't necessarily mean that West Hill is a problem. West Hill is a big campus, so you would expect more cases, but you would expect more cases in some places and fewer cases in another just by random chance. If you go to Atlantic City and gamble, you'll find, and go to the roulette wheel, sometimes you'll get red and sometimes you'll get black, and once in a while you get double zero. It's just the way it comes out. The chart on the right is showing the number of people that have been put into quarantine. That's cumulative since, it says since 11/3. I think it's cumulative as reported on 11/3. And you can see that Tokwam only had 5 cases, but has 84 people quarantined, whereas West Hill, with many more cases, has got 55. And what's going on is that's where the contact tracing comes in. The health department is trying to identify if there is a case that comes into the school, what happens, who's been exposed, and is it spreading? And basically, they try to identify anybody that could be in danger that needs to be quarantined. And secondly, they're looking to see if it's actually spreading in the schools. When you look at these number of cases in the schools, they are about what you would expect given the number of cases that we have in our community. In fact, the superintendent and I had spoken even before schools opened in September, and we had talked about how many cases we expect to be in the schools in September. And guess what? It was pretty much exactly what we predicted based upon the number of cases we saw in the community. And as at least since the last time I talked to the good Dr. Calder, who is our director of health, yesterday, I think it was, I've lost track of time. The last couple of days have been a blur. There is no evidence that we actually have any spreading going on in the school. There are cases of people who go to the school, and sometimes they go to the school, and sometimes those cases are spotted before they even get there. These are cases of people who technically attend the schools, but they may not have attended. And regardless, we're not seeing spread occur, but we are seeing cases in the schools. Next slide. Just so you know, some of the things that we're doing is we are stepping up enforcement. You may have seen, if you follow the Advocate, that we closed down a couple of restaurants, small restaurants, last Sunday morning at 12:30 a.m. because they were violating the rules. But most importantly, we are now stepping up once again our testing protocols in addition to going to Stamford Hospital. If you call ahead and get an appointment or talking to your primary care physician, we're now setting up these particular testing activities. The next one is in fact Thursday, tomorrow, at the fire headquarters on Main Street from 9 a.m. to 12 p.m. And part of the reason we're pushing this is that some people don't have a primary care physician. Some people don't have insurance. If you have been exposed, particularly if you've got symptoms, I don't care if they're mild symptoms or severe symptoms, if you have symptoms that look like a flu or a cough or a cold or coronavirus, you should be tested. And if you can't easily get testing, contact the city, either at our health department or any other way you want, and we will figure out how to get you to a testing site. In most of these testing sites, you don't have to register in advance. If you just show up, we'll figure out how to do it then and there. We want to make certain if you might have been exposed, it's helpful to know, do you in fact have the coronavirus? And that's why we're doing that. I think that concludes my presentation. Next slide, please. Yes, it is. And if Dr. Calder, who is our Director of Health, corrects me because I made a mistake, just understand that she has doctor in front of her name and I do not. So if I made a mistake, you listen to her about protecting your health more than me. Dr. Calder, take it away.
Thank you, Mayor. So thank you, Dr. Lucero, for planning or hosting this event, and good evening, everyone. And just so you know, I like speaking after the mayor because I get to say less. He usually covers everything and he gets it quite accurately. So it's always good to follow Mayor Martin. So I'm really happy to get this opportunity to speak with you today because it's, you know, we really get the chance to talk about what the health department is doing. So many times people are unaware of what's going on behind the scenes. You only hear, you're only aware of us when we tell you, no, you can't do something. That's sort of the image that we get. So it's always a good opportunity to share with you some of the hopefully positive things that we've been doing. So I wanted to use my time. I have no slides, but I just want to speak. I wanted to use my time to talk to you about 3 topics. First, how to protect yourself and your family. I'm a director of health. I can't help myself. I have to do it. And and the other thing is the public health recommendations for testing. The mayor sort of touched on that. And my third topic is the role of contact tracing in preventing and controlling the spread of COVID-19. So we're still learning a lot about this virus. However, while we learn about the virus, the Department of Health is charged with preventing and controlling the virus. So to do this, we have limited scientific information and limited knowledge. So we're forced to use the tools that we have successfully used in the past to prevent transmission of other diseases. And as we learn more about the virus, we adjust these tools to be successful in the prevention. In public health, when we speak about prevention, we talk about 3 types of prevention: primary, secondary, and tertiary. And the main goal of public health is what we call primary prevention. In other words, we want to reduce the likelihood of exposure happening that could lead to disease. That's the first thing we want to do. So some of the things that we do when we're talking about primary prevention, you're very familiar with. Vaccination, that's one. Wearing protective gear such as masks, gloves, fire-resistant clothing, that's primary prevention. And eating healthily, those are all things that we consider to be the basic prevention efforts. So as part of our primary prevention efforts to control the spread of COVID-19, the public health message continues to be: wear a mask that covers both your nose and your mouth. Stay 6 feet from each other, wash or sanitize your hands frequently, and avoid crowds. As a matter of fact, today, the Department of Public Health emphasized that it's pushing this concept of avoiding crowds in addition to the other preventive measures that they recommend. Also, if persons suspect that they're infected or are diagnosed with COVID-19, they should self-isolate to prevent transmission. So you shouldn't be going to your friend's party or barbecue, or, you know, if your doctor tells you to keep Johnny at home, you should keep Johnny at home during that quarantine period or isolation period. These are all the steps that you can take to protect yourself and your family and others around you. We've also heard a lot of talk about the COVID-19 vaccine. And there's a lot of research that's undergoing to develop this new vaccine. And we're hoping that one day we'll have a safe and effective vaccine as a part of the toolkit that we could use for primary prevention as we use the influenza vaccine. When we use secondary prevention in public health, exposure has already occurred. And the disease process may have already started, even if you don't have symptoms. So what we're trying to do at this point is to detect disease early, treat early if possible, and prevent progression to disease, to visible disease at least. So an example that we're very familiar with is screening for high cholesterol. You go to your doctor particularly when you get to a certain age, they start screening you for cholesterol because they know we've all been eating poorly. And they're trying to identify whether we have high cholesterol or the bad cholesterol and put us on treatment to prevent that heart attack that we know is really devastating. So when we think about COVID-19, the public health message here is get tested so we can identify persons who are infected early and who may not even be aware that they are infected, have them evaluated by their doctor, and also prevent infection from occurring. So to help us with that secondary prevention, we're continue to recommend that you and your family members get tested, even if you don't have symptoms. And we also recommend that you stay home until you get your test results. Now, I know the last thing is very hard to do, particularly when you don't have symptoms. But if possible, you should stay home until you get your symptoms. And finally, in public health, we talk about tertiary prevention, and that focuses on preventing death and disability. So now you have the disease, and this is a COVID patient who has to be hospitalized and be put on the vent. And so now we're in tertiary prevention. And public health, you're usually working with Dr. Yoon at that time, not with me. And we try to put Dr. Yoon out of business. We do primary prevention. We don't want them to get to Dr. Yoon. That's public health, primary and secondary. Dr. Yoon is not our friend. We don't want him in business at all. But that's what happens when you're tertiary prevention. So one of the tools that we've been using to control COVID-19 is called contact tracing. And contact tracing is considered secondary prevention. It has a very long history that dates back to the 16th century in Europe and later became standard practice in the United States around 1920 to prevent to investigate and prevent the transmission of sexually transmitted diseases. Since then, infectious disease epidemiologists like myself, we use contact tracing all the time to investigate diseases such as TB, measles, Ebola, smallpox, hepatitis, HIV, and now we're using it for COVID-19. Today in a conversation with somebody from DPH, we're kind of laughing to say, boy, can you imagine doing contact tracing for COVID-19 using the forms we use for measles? We'd die. We use Excel spreadsheets. We'd have a meltdown. You get 5,000 cases. So this is something that we've always been doing, but certainly COVID-19 has challenged our ability to do contact tracing effectively. So contact tracing is important for COVID-19 because it helps us to identify persons who were exposed to an infected person, monitor these infected persons for symptoms, recommend testing if appropriate testing is available, provide post-exposure treatment or vaccination if one was available, and to isolate or quarantine these persons for a period of time to prevent additional transmission. So for us to be able to do contact tracing effectively, it requires a team effort, a partnership between the Department of Health and the public. It is important that you speak to us when we call you. I know many people are very concerned because we're government, and I'm the government, I'm here to help you, and nobody's drinking that Kool-Aid. But truthfully, we need you to work with us. You may be concerned about privacy issues, but I want to reassure you that the state of Connecticut's public health laws protect the information that we collect from you. It's sometimes more protected than what you would give to your doctor. Dr. Yoon is not happy to hear that, but yes, it's really protected. So with that, I'm going to turn this over to Dr. Yoon and my team, who are the city's medical advisor, for them to describe for you how contact tracing is done. Thank you very much.
Thank you, Dr. Calder. And thank everyone for taking the time to attend this webinar. to help educate yourselves and the community and your friends and family. What we're hoping to do today, Ms. Bryson and I, is really take some of the lessons that Mayor Martin and Dr. Calder have been talking about and really bring it to a more granular level when it comes to what we're doing here in Stamford. And so hopefully this will help. I know there are a lot of questions. We get questions all the time on what we're doing and why we're doing it. And information is power. So the hope is that if we can try to share some of this information and sort of demystify the process, that people will understand that this is a good thing. And this is something that will not only benefit themselves and their loved ones and their neighbors and the community and the rest of humanity. So if I can get the next slide, please. So we will be talking about contact tracing as we've been talking about. Next slide. So just very briefly, I know that Mayor Martin has mentioned it, Dr. Calder has mentioned, what exactly is contact tracing? And if you boil it down to what it really is, it's a process. It's a process that we go through to help identify people who may have been exposed to a person with a communicable or spreadable disease. And as Dr. Calder had mentioned, this is not new. We've been doing this for quite some time and applying these techniques and these strategies to COVID-19. And where it begins is it really begins with the recently diagnosed person, right? And what happens is we go through this process to try to identify everyone who's been in contact with, or you may also hear it as exposed to this person who is sick since they've become contagious. Next slide. So why is it that we do it? As we've mentioned before, again, the idea of contact tracing is to slow the spread of COVID-19. It helps protect you, it helps protect your family, and again, it helps protect the community. And how does that do that? First, it helps you know that you've been exposed or the person has been exposed to someone with COVID-19. Many people, most people don't even know that they've been exposed. And so this process helps identify contacts or people who may have been exposed so that they know to look for signs and symptoms of COVID-19, to be particularly astute, to look for those types of signs and symptoms to see if they're sick. If they are, the contact tracing process, again, helps identify those so that they can get tested. Dr. Calder talked about the fact that early testing is going to be a key part of bending the curve, getting rid of the virus, slowing the spread, because when we can identify people who are sick, who have the disease and who are contagious, we can remove them from the regular population so that they're not spreading the disease amongst other people. And finally, once we identify, or once those patients are identified as having the disease, as I had mentioned, they need to be taken out of sort of the general population so they're not spreading it. And they do that by isolating or quarantining if they're a close contact. Again, it's essentially the same, where you're removing someone who could potentially be spreading the disease and separating them out until they're better, or until they show that they will not develop the disease. So next slide. So a couple definitions I want to mention. Next slide, please. And these are things that you may have heard time and time again, but I want to make sure we're on the same page when we're talking about these things. So a case. So a case is someone who is sick. And I guess I should clarify that. And by sick, I mean someone who is tested positive for the SARS-CoV-2 virus by either a PCR or an antigen test. And these are things that everyone's heard time and time again. So again, just to make sure that we're on the same page, there are primarily two types of tests that we're currently using to diagnose COVID. One is a molecular test or a PCR test, and the other is an antigen test. And they're two different techniques to help identify whether the virus is around. Both of them have rapid versions. So I know a lot of people talk about the fact, oh, it's a rapid test, it's not a rapid test, and assume that if it's a rapid test, it's one or the other. But rapid tests are found in both, using both the PCR technique and as an antigen test. So what's important to remember is PCR, or molecular test, and then the antigen test. So please do keep that in mind. Next slide. And a contact. I know we keep throwing the word around, but the way that we're defining it in public health and how we're using it in these scenarios is a contact is a person who's been exposed to a case, right? So we just defined a case as someone who has COVID-19, someone who has the disease. And so a contact is someone who's been exposed to that case. And we define a significant exposure as someone who spent 15 minutes or more accumulatively, meaning in total within a 24-hour period. So whether that's 5 minutes at a time, whether it's one time for 15 or 20 minutes, that's what we're considering the time period when we consider a close contact. And the second part of that is within 6 feet of a positive person. So that's considered a significant exposure. 15 minutes cumulatively within 6 feet of a positive person, or direct exposure. And by direct exposure, I mean, we find out later that someone who's had the disease accidentally coughs or sneezes and remembers that they had done that, or figures out that, you know, that's someone that they've come in contact with. So that type of direct exposure is also higher risk activity. So those people are considered contacts. And I want you to keep that in mind, because we're going to mention this over and over again as we talk. Next slide. So let's get even more concrete about the contact tracing process in Stamford and at Stamford Public Schools. Next slide. So I'm a visual person, and so I hope that this helps, because it certainly helped me kind of figure out what it is that we're talking about, what it is that we're doing. So this is a student who's a positive test, who has a positive test. They are a case. What happens at that point is the case is reported to the contact tracing team, and that's done in many, many different ways. And in public health and in the healthcare system, we have several different ways that cases get reported, because we don't want to miss any of them. And Ms. Bryson is going to talk a little bit about how we do that in Stamford. But eventually the cases get reported to a contact tracing team. At that point, the contact tracers or the contact tracing team interviews the case being the sick person, right? Because they need to get some information to help identify contacts, to figure out who it is that they need to reach out to. And so what is it that they do, and what is it that they ask? If we can go to the next slide. They ask questions such as, to the case, about specific exposures, while in this particular case, the student was in school. Where were you? Who were you with? What classes were you in? Were you inside? Were you outside? You know, these kinds of things. So again, where were the spaces? What sort of control measures were in place at the time? Were you wearing a mask? Were you not wearing a mask? Were you able to maintain distance from people? So all these different things help in the assessment process to determine the risk. Because sometimes, depending on the level of risk, there may be nuances where we change recommendations. So these are things that we need to know, and this is information. And so when Dr. Calder asked, really pleaded for people's cooperation and collaboration in this process, this is why we need this information, to really get a handle or wrap our heads around what the circumstances were, so that we can make the most educated recommendations to help protect everyone. And there are going to be circumstances where perhaps the questions are going to be, I don't know. And even that's important to know. So we've had cases where people didn't know the people they were around. They were out shopping. They were at a grocery store. They were at a rally of some sort, and they don't know. So at times like that, once we do an assessment of risk, we may have to make recommendations that say, well, we're not exactly sure, we want to be safe, so we need to do this, this, and that. So all this information is very, very important. And so that's one of the big jobs that the contact tracers do. Next slide. And so at that point, once they've interviewed the case and collected this information and work with them to go back and figure out, well, who were those people that were contacts? And remember, we talked about contacts, either direct exposure or a cumulative 15 minutes within 6 feet. And they will then go and reach out to those contacts and let them know. And there begins the process of contact tracing. Next slide. And we do this because once those contacts are identified, as Dr. Calder had mentioned, we need to quarantine them, right? We need to take them away from the general population and keep them from spreading the disease, or if they don't already have the disease, waiting that incubation period to make sure that they don't develop the disease. Next slide. So Ms. Bryson's going to take a few minutes to talk about how the specifics are in Stamford Public Schools, so that hopefully it demystifies the process a little bit for everyone. Ms. Bryson?
Okay, so really contact tracing within the school, we like to call it an exposure investigation. It's just a slice of the contact tracing. As you can see, it's much bigger, the contact tracing of everywhere that positive person or that case has been over the last 2 days, usually before symptoms occur. You can go to the next slide, please, Ms. Gonzalez. Thank you. Here are some beautiful pictures that Dr. Yoon put together for us, showing how all the different spots that really there could be school-related exposure. The school bus, that's why we have many strategies in place to help to cut down on children sitting right next to each other. With the hybrid model that we're using, we have less children coming to school every day, so we're having the children sit every other seat. We're having the elementary school children are assigned seats, so they're coming in and sitting in a specific seat, and we're trying to cut down on the exposure that happens on the school bus. Sporting activities are another place we are seeing some activity out in the community where a child, could be positive playing soccer, and then you might get the call that there's a positive person with COVID on your soccer team, and then you have to stay home for 14 days from school and from all activities because you were exposed during the soccer game. But this is just a good little overview of all the different spots where transmission can occur. However, for us, because we have such a great plan in place at school with all the children 6 feet apart and wearing masks and washing their hands so frequently, we're not seeing really the transmission within the school building. These cases are being tracked to mostly coming from home or from a family member or a relative or a friend. So that's what we're seeing so far. You can go to the next slide, please. So how is the school notified? Usually there's different ways we can be notified. A parent could call and tell us that they had their child tested and the child came back positive. Or a teacher could let us know that they tested positive for COVID-19. We could find out through the health department because it is a reportable disease and we get notification, and through contact tracing, our contact tracing network, it comes down from the state database. Or your medical provider could contact the health department, the Department of Health, and the emergency department. Sometimes if you go to the emergency room at the hospital and they find that you're positive and they know that you're a student, find out you're a student here in the Stamford Public Schools, they will alert us as well to the fact that, so-and-so is positive, so we know to reach out and help to set up a plan and contact trace for you. So when the schools are notified, basically the positive member or the parent, so if it's a high school student, sometimes we'll talk directly to the high school student because they can answer where they've been, who they've been less than 6 feet for more than 15 minutes accumulatively. Usually the principal start by making like a list. Who is the positive person? If it's a student, does that student get any special services like ELL or a reading specialist or special education services? And if that's the case, they make a list of all the people that might have close contact with that student, and we come together and question that those particular, the teacher. Now, we like to protect as Dr. Calder was speaking of before, we like to protect the identity of all positive people. Some positive parents will reach out and call the teacher themselves, email the teacher, tell them, which is fine. You can do that if you choose to, but we don't want to go and say, Johnny is positive. So what we do is we go to the classroom teacher and we'll say, okay, in your classroom are the children all 6 feet apart all day long. And they're all sitting in seats that are set 6 feet apart. Do they remain in their seats all day? When they have breaks, do they maintain the 6-foot social distancing? When they eat lunch, they sit in their seats to eat lunch, and so they're all 6 feet apart during that time. And what we do is we investigate, where's the positive person or the case closer than 6 feet for more than 15 minutes with any specific teacher, student, what's happening during recess, what's happening during phys ed, what's happening during music and art. We look at all of these portions of the day and decide. And for the most part, the rules are the children are 6 feet apart, the staff is 6 feet from the children, and everybody has a mask on, everybody's washing their hands frequently and using hand sanitizer. So therefore, it makes our life a lot easier because for the most part, everybody's following the rules, and therefore there is no contact. Now, if we determine there is contact, this is done with the teacher, the principal, the school nurse is involved. I am involved usually to some extent, and we answer questions, we figure it out. The teacher, sometimes I give a teacher a little time to think about it, and then I get back to her and yeah, that her or him, and sure enough, yeah, you know what, I tested the student one-on-one at my kidney table, and I think maybe they were exposed, they were sitting next to Johnny or whatever. So we narrow it down, and we are able to figure out who were contacts during that school day. I think you can go to the next slide. I think I jumped ahead. So, and then at that point, what we do is we notify the administration of the school building notifies whoever was a contact with the positive person, and we send out, we notify them in via phone or in person if they're at school at the time, and we send people home that are in quarantine, and we send out letters to let everybody know in the school environment that there was a case at that school. And if you were a contact, you are notified again in writing that you were a contact or your child was a contact. And that's pretty much how we're doing it. This is a wonderful little calendar that explains how we figure out, because when you develop the symptoms, you go back 48 hours from that day to see when you were infectious. So if you started to feel bad on Friday, we look at Wednesday and Thursday. That's where you developed a fever on Friday. So on Wednesday and Thursday, who did you come in contact with? That's where we begin the investigation. And then you remain out for 10 days, and you may not return to school if you're a positive person for 24 hours fever-free without Tylenol or Motrin, ibuprofen, Advil, any of those medications that decrease fever. We don't want to mask a fever. We want to know that the person is fever-free. So when you're 24 hours fever-free and 10 days have passed, you're allowed to return to school. If you are on quarantine, however, you stay out for 14 days. From the date you had contact last with the person. So if you were in class on the 5th and you were in close contact with a positive person and we put you out on quarantine, then you would remain out starting on the 6th, day 1 for 14 days before returning. I want to report that really, this is working very, very well. We're seeing people coming back out of quarantine, and this plan that Dr. Lucero and many, many people sat on and worked on from May until the opening day of school. And even after that, we still continue to meet. It's a good plan. And I think that that's why we're not seeing the transmission in schools. And I think that some are saying schools are safe for the children to be in school right now, because it's the 6 feet apart is the key, I think, and the mask wearing and the washing of our hands. And I think that the teachers are all teaching the children wonderful, wonderful way to get through a pandemic, and wonderful skills to rally through and try not to get infected. So I think that was our last slide. Yes.
Great, thank you. So I'm just going to finish it off very quickly in the interest of time, and just share a scenario that leads to a common question that we've gotten before. Next slide, please. So it has to do with siblings. We often get questions, what happens to the siblings, the brother or sister? And the answer is, it depends. It depends whether whether the student is a case, whether it's a contact, or whether they just have some other illness that's not COVID-19. So again, being a visual person, hopefully this diagram helps. And I've got to give credit to our Connecticut Department of Health, who helped with a lot of these slides. So I can't take credit for myself, but I do want to give them kudos. In any case, so if you look on the far left, there's a sick child. And by sick child, we mean someone who's just sick, who has a cold or something like that. So if you have a sick child who does not have COVID-19, who's not been diagnosed with COVID-19, what happens to the siblings, the brother or sister? There's no reason why they can't go to school. They may try to convince you otherwise, but there's no reason that they can't go to school. Now, if they get sick or start developing symptoms, obviously that's an entirely different story. They need to stay home and they need to be evaluated. But siblings of sick children don't necessarily have to be excluded from school. The middle case is again the case. And remember, the case is someone who's had a positive coronavirus test, right? And so if a student is a case, then their siblings, by definition, become contacts, right? And as we talked about before, contacts have to self-quarantine for at least 14 days after their last exposure. And basically, I think it just makes sense that pretty much everyone in the house at some point in time will have spent at least 15 minutes or have been within 6 feet of the case. And so we automatically assume that all household contacts, people in the household are considered contacts at that point in time, and they should be all quarantining for at least 14 days. So in that case, the sibling is a contact and therefore should be quarantining and should not be going to school. Now, the third scenario in this particular case is the contact. And what I mean by that, and this is where it can get a little bit confusing, so please bear with me. So if the student is a contact, meaning the student was exposed to someone who had COVID-19, if the student is a contact, then the siblings are what we call a contact of a contact. And so they don't need to be excluded from school because that sibling has not been exposed to the person with the disease or the case. Now, sometimes siblings share friends and again, may have come in contact with them, and that's a different story. So if a sibling has come into contact with the case, then that sibling is a contact as well, and they need to be quarantining. So to summarize that, if you go to the next slide, you'll hear time and time again in the public health community, a contact of a contact is not a contact. Sometimes I think I go to bed hearing this over and over and over again. A contact of a contact is not a contact. And that's summarized in this particular slide. So you have a case, If you're a case and you're positive, you need to stay home until you need to isolate until you're no longer infectious. And that's at least 10 days and 24 hours fever-free without fever-reducing agents and improvement of symptoms. If you're a contact, someone who's been exposed to a case, then you quarantine for 14 days. And again, the third case, a contact of a contact is not a contact. So in that particular case, there's no quarantining required, nothing else that specifically has to be done. So if you just look at the last slide, this is just a reminder of some of the mitigation strategies that we recommend at home and that we know that we're doing at school, between face coverings, disinfection, social distancing, good hand hygiene, washing your hands or hand sanitizing. And in the school's environment, we're doing the cohorting. So separating them into groups so that if by chance there is a case, there's less exposure to less people. So hopefully that helps. Hopefully that helps understand a little bit about kind of what it is that we're doing. So thank you. I think I'm going to turn it back over to Dr. Lucero to talk a little bit about the dashboard.
So thank you so much. I cannot tell you how much we appreciate our health department and our medical advisors for all the support that we get. I joke with I joke with Mayor Martin that we use his staff a lot in Stamford Public Schools these days, and we appreciate all the work that they do for us every day. I think it's really important to know, and this was very clear to you, that the contact tracing, although we support it in the buildings, it is not the staff that is doing the contact tracing. We support the school nurse and the health professionals at the health department to do the contact tracing. So we may do the groundwork for them, but they're the ones that are helping us make that final decision, because it really is about keeping all of our staff and all of our students safe. When we decided that we were going to return to school, we repeated over and over again, we are going to put health and safety first. And that's what we've done here in Stamford, but we would not be able to do that without our health professionals. One of the other things that we think is really important is that we're really transparent in sharing with you how many cases that we have in the school. And so every week there is a dashboard that is released on Thursday afternoon. And if we could go to the next slide. This is our dashboard. It's been out for a little over a month now, and it just allows you to see all of the new cases that we have every week. And then we also show you how many in total we've had. So this is the same information that Mayor Martin uses to run his data. And the reason why we want you to have this information, because we want you to see by percentage we are really at a low level. And I think DPH at the state is repeating to us over and over again that schools are some of the safest places you can be right now, because we immediately exclude people if they test positive. If they're sick, we're asking them to go and get tested. We are doing really good hand hygiene. We are wearing masks. And in Stamford, we are staying 6 feet apart from one another. So because of that, it's one of the safest places you can be. But we will be watching these numbers very carefully. Dr. Calder, myself, and Mayor Martin will be meeting on a regular basis so that we can track these numbers and clearly understand that when it's no longer safe for us to be in school, that we will transition to remote learning. But at this point, we really feel like that we are able to stay on top of all of our positive cases, and we are able to contact trace in a very comprehensive way. And then we are able to ask people to quarantine and then return to school. So that is our presentation for tonight. We now are going to turn it over to Dr. Fernandez. He is going to walk through some of the questions that were presented to us this evening in the chat. So Dr. Fernandez, if you want to join us now, And if you just run through some of the questions, we will take, if we don't get to all of the questions this evening, we will be answering them in our frequently asked questions that we will post on our website. Dr. Fernandez?
Thank you, Dr. Lucero. It's great to be here this evening. I want to thank the panelists for a very thorough and informative presentation. Very well done. I think many of your questions were answered with the information presented. There are a lot of questions. I'm going to try to focus on some of the questions that have been repeated by multiple participants in the meeting. This first one sort of touches on what you just ended with, Dr. Lucero, and I'm going to open the questions to anyone on the panel to respond. But this is, as we know, this is a complex issue. This person, and there are a few questions related to this, is questioning Stamford being in the red zone and our public schools remaining in the hybrid model, and asking whether the schools should be changing their operating model. I'll open that up to the panelists.
So why don't I start? The most important thing is disease spreading. If the disease is spreading, then we need to shut it down or do something more to stop the spread. Right now, we don't see any evidence that the schools are spreading the disease. So we want to keep them open. I personally believe that the hybrid model is better than closing the schools. I think it's much better for the students. So that's where we're going to keep up. Now, it could be that if the cases in the community get so high that we can't even keep up with the contact tracing, then that's a different situation. Or if the governor orders a general shutdown across the whole state because the state can't keep up with more cases. But as long as we can contain the number of cases in the community and we don't see any spreading, I don't see a need to shut down the schools, even though, some people might be concerned about that. And I don't know if the other members of the panel feel the same way or differently.
So, Mayor Martin, I agree. I think there's clear evidence that we don't have transmission occurring within the schools. And I'm usually ringing the fire bell downstairs and, saying, shut this down, Mayor, please, I'm begging. But I've not requested that the schools be closed at this time.
Just so you know, she has done that. She had gotten a message, this is an emergency, shut this down. And I have done it.
So I have not, and my staff, they're on the front line, but I get the reports daily and they consult with me. And if there's something, I'm constantly making sure that Dr. Lucero, Mayor Martin, and my immediate supervisor, Mr. Jankowski, is aware. And at this point, I would have to support both Dr. Lucero and Mayor Martin that I think it is still reasonable to keep at least the public schools open. I've also not heard anything occurring in private schools, but we have gone into the red zone in the community, and we have to watch that because people are coming from the community. And the day we see transmission within the school, we would be having a more serious discussion.
All right, the next question. There's a number of questions about testing. One is that, are there any plans to increase testing sites and make it easier for people to get tested? Some people have experienced extremely long waits to get tested. So is there any plans in that area?
We are increasing our plans for testing. We work with different partners to conduct testings, both partnerships with churches, partnerships with the NAACP, partnerships with some of the grocery stores. We're expanding our testing, but in fact, when you haven't pre-registered, sometimes it takes a while, and sometimes if there's a big line, it does take a while to get through the testing, and we're trying to improve upon that. I think the biggest challenge is this: there is a shortage of materials to do nationwide testing. And partly because of that, you find that some people are using different types of tests because this is the only one they can get. If this is the only test you can get, this is the test you use. And some tests give quick results and some tests take longer results. Some tests cost an incredible amount of money and some are relatively cheap. There's a lot of different features, but mostly it's about what tests can we get, because all the tests are better than just guessing. And we're trying to put more testing capacity out there, but we are struggling both with the amount of testing materials and struggling with the staff necessary to conduct the testing. But we're doing what we can, and we are ramping it up again.
Related to that, Dr. Yoon, you spoke about the two different types of tests, and this particular person's asking, she's heard a lot about false positives that happen, and she's wondering what is the most appropriate test to get? What should you do when you're concerned about possibly having COVID-19?
Well, the short answer to that question is this: the PCR test, or the molecular test, is the more reliable test, hands down, and there's no confusion about that within the healthcare and the medical field. There are, however, the antigen tests that are out in the community may be a little bit easier to get in some places, and so, as Mayor Martin had mentioned, it's better to get tested than not. So the Department of Health and the CDC recognizes that a positive test, whether it's a PCR or an antigen test, is treated as a positive test. If the antigen test is a negative test, that's where it becomes a little bit more complicated. And that's where people may have been hearing things about false positives, false negatives. And that's where it becomes really important, again, to work with the health department, to work with your healthcare provider, because they know you the best. They're going to know your risk factors. They're going to be able to guide you in terms of what the best course of action is. And of course, at the health department, we're resources for them as well.
I just wanted to add two things. One is that oftentimes doctors or the health department will in fact say, well, let's take a second test. You may have been negative, but you have so many comorbidities. Yours at such risk. We want to be extra sure. Or you may have come up, or just the opposite. You have a positive test, but we don't see any symptoms at all. Maybe we should check. But I tell you this, do not use they're not perfect as an excuse not to get tested. And to be silly, stupid about this, everybody's taking tests, history tests, math tests, science tests. You take tests in schools. And I'll tell you that almost everybody I know feels that sometimes the test you take doesn't exactly tell you how much you knew about what happened during the Revolutionary War or something about geometry or whatever you were testing. Sometimes the tests aren't perfect, but don't use that as an excuse not to get tested. You are risking your life and the lives of others around you if you think, well, they're not perfect. So don't let perfect get in the way of being good.
Thank you, Mayor Martin. Thank you, Dr. Yoon. One last question regarding testing. Someone's asking how often should they get tested? When should they get tested? But really, how often should they get tested?
So I'm gonna tell you that if you're symptomatic, well, let me take a half step back, and again, maybe it's just a plug for medical providers since Dr. Calder wants to put me out of business. But talk to your medical provider, right? They are going to know you the best. I think most of my medical colleagues out there will err on the side of caution and test when appropriate, when they think it's appropriate. If they feel as though that there's not a clearly alternative diagnosis for some of the symptoms that you have. What also needs to be kept in mind is when there aren't as many cases out in the community, that affects our judgment as well. At some point in time last year or earlier, when we were in the peak of the pandemic, pretty much everyone with all kinds of symptoms just needed to be tested. So to answer your question, when should you be tested? When your medical provider tells you to, and that will usually be when you have symptoms.
Thank you. This next question I know was answered during the presentation, but I think it's worthy of being asked again just for clarification. How many days prior to symptoms would a case need to have contact with a person in order to consider that person a contact? And there was this person actually experienced a situation, but I know that that's come up a few times.
Well, I'll say that the rule of thumb that we use and what science has shown is that the period 2 days or 48 hours prior to the onset of symptoms is a potential infectious period. And so people may not have developed symptoms at that point in time, but we know that the virus can still be transmitted. So we start our contact tracing 48 hours prior to the onset of symptoms.
And I'll just add that there are times when we test individuals who are asymptomatic. So if we have a positive test, we use the date of test 48 hours prior to the date of your test, but we prefer onset of symptoms if that's what we have.
There's a question about not wearing masks. Why doesn't prolonged unmasked contact count as exposure? An example is the students are 6 feet apart in their classroom, but they're having their lunch and they're unmasked for that time.
I'll take that one. So when we look at disease transmission, there are different types of transmission. So we've divided transmission into what's called contact, meaning I have to touch the surface or touch you. The other is transmission that occurs via air. Some pathogens, if you're within 6 feet of the person, closer than 6 feet, that pathogen will transmit to you. But if you're further than 6 feet, it won't transmit. So the SARS-CoV-2 virus is one of those viruses that transmits just up to 6 feet. TB, on the other hand, we consider it to be airborne. TB is transmitted in the air. It can go through the air ducts. So we have to put you in what's considered a negative pressure room if you have TB. If you recall, when we started this pandemic, everyone was put in we wanted to put everyone in negative pressure rooms because we didn't know enough about the virus. Now we know that if you're beyond 6 feet or further, the virus will not transmit that far. So that's why we make the recommendation of 6 feet. Now, I'm sure you may sometimes hear if you go to a concert, they want you to be 12 feet. That's because people are singing and they're throwing their voices. So the assumption is because of the force of singing, the virus is being spread beyond the 6 feet. But if you're not engaging in anything like that, it's 6 feet.
Here's another question about the contact tracing process. When we determine that there's a case in a school and we require individuals to quarantine for 14 days, are they required to have a test before returning to school?
We recommend testing if you're a contact, just to identify, this is early detection of cases. But if you chose not to be tested, you can return to school because the 14 days is considered the maximum for the incubation periods. But we just it's recommended that you get tested, but not mandated.
Thank you, Dr. Calder. I'm going to ask this question also about contact tracing. What does contact tracing look like out in our red zone community? Do we have healthcare workers conducting these with individuals out in the community? Are our health workers multilingual?
The health department does the contact tracing for the entire city of Stamford. We do have a language line that covers 100 languages. So if my staff need to speak to someone who doesn't speak English, we use the language line, and we can use it on our cell phones, our iPads, our computer. We can use it on a landline phone.
Thank you. There are a few questions about asymptomatic individuals. What if a child or teacher is asymptomatic? How does that play into the contact tracing process? There's been a few questions about asymptomatic individuals.
So I guess the person who asked the question may not be able to answer. So if the person is asymptomatic and positive, they're considered a case. And we would treat them like someone who was symptomatic and positive in terms of our contact tracing processes.
And if I can just add to that, I think what that question, or one of the takeaways from that particular question is reinforces the idea that because there are potentially asymptomatic people, it's even that much more important to use those mitigation strategies that we have in place. That's why they're there. Asymptomatic carriers or asymptomatic patients are sort of the bane of our existence. We by definition, they're asymptomatic. So, we can't say, go get tested, you have symptoms. So again, that's why it's so important to wash your hands, wear a mask, and socially distance so that you can reduce the risk as much as possible, even for asymptomatic people.
There's a couple questions more on the educational side. Dr. Lucero, maybe this would be for you, maybe others. What is our threshold for going to full remote learning? And then related to that, a parent asked, would we be given advance notice if that were to happen?
So that's why we have a plan to meet several times a week, and Dr. Calder and Mayor Martin and I are in regular contact with one another so that we are tracking a lot of different things. We are not just using one factor to determine whether or not we're not getting to a certain number and saying, okay, we all need to leave school. We've learned a lot since March. And because of that, we're using all of the good information we have to make those determinations. And that's the guidance that we're being given from the State Department of Health. And that is the guidance we're given from the State Department of Education. It is really important that each community is working together. And this is why we had this meeting the way that we did. We could have, as a Board of Ed, just said, let's talk about contact tracing within the Stamford Public Schools and not include the city in this process. But the point is that there are a lot of things that we put in place in Stamford, being 6 feet apart, hand sanitizing, wearing the masks, that are keeping us very safe. And so we, a few months ago, would have thought, oh, this is, if we get to a certain number, over 25%, we're going home. But now we know that we're going to look at it case by case, have conversations with our health department and with the mayor, and make those decisions. And our hope is that we're tracking it so closely that if we're getting close, we would provide that information to families so that they could start to prepare. But one thing we have to remember, Thanksgiving is coming up. We need to make sure that we're paying very close attention to how we're traveling and how we're intermingling with one another. If we really want to stay in school, it's going to take all of us working together. It can't just be within the school building, we're doing what we asked you to do. Sometimes I walk over, I live on Summer Street, I walk over on Bedford Street, and I think there are too many people here. This is what we need to be thinking about. The sports that go on. We really need to be thinking about, are we always staying 6 feet away from one another? Are we practicing good hand hygiene all the time? And do we have on our masks properly all the time? So that's a long way to say that it goes further than within our school buildings.
Dr. Lucero, if I can add to that, I just also wanted to comment, because that is a question that is asked by everyone, not only parents, but at the schools, at the Department of Health. We at the local health level ask the state DPH all the time, and I'm sure that they're asking CDC all the time. It's a very valid question. It can be very frustrating for people to not know, and they will ask, I will ask, well, can't you just, what is the threshold? What boxes do I have to check to say that 1 + 1 = 2? And the answer that we've been getting, and the answer that I think I'm at least starting to get more comfortable with, is it's a moving target. It's a moving target because there's so many different elements, parts of the formula that we have to regularly assess. And I think, again, that's to your point, when you're getting together with Mayor Martin and Dr. Calder and looking at some of the guidance that DPH provides as a spectrum of risk, and then look at how much transmission we have in the community, how much transmission we're having, if at all, in the school, how much, how well are we doing with these other mitigating strategies? So hopefully people will understand, because it's definitely a question that I've asked for my school age children. What's it going to take? And I'm having to get a little bit more comfortable with the idea that it's a number of different considerations. And I think that as we communicate that as far out as possible, will be best for everyone. So thank you.
So
Dr. Fernandez, it looks like we have time for one more question. I know Mayor Martin wants to speak, but I do want to be clear that at 8 o'clock, this is going to cut off. So Mayor Martin is going to speak, and Dr. Fernandez will ask one more question.
I'll be very brief, and that is that we will want to give parents and school children as much notice as possible. But more than likely, it will be very hard to give very much notice. And the idea, well, we're going to be this week, but next week we're going to be shut down, doesn't quite make sense, because we want to keep school open unless we can't. And if you could think about the contact tracing, imagine for a second that you've got a school and 3 unrelated people report that they had a positive coronavirus, and the health department finds out about it at 8 o'clock in the evening. Are we going to open schools tomorrow? We don't know who needs to be contact traced and kept in quarantine. And we had that situation. It might have been in Davenport, I can't remember. We couldn't contact trace fast enough. And as a result, a school was closed the next day, just so that we could catch up to something that we'd learned very, very late in the day. So I just want everyone to know that's out there. We want to give as much notice as we can, but given the nature of this disease, it may be hard to give very much notice.
This question I don't think was discussed during the presentation. It has to do with surface transmission. Should parents be worried about surface transmission in school, touching a desk, touching papers? And is there a time period after which you don't have to worry about surface transmission?
I guess I'll take that one. So there's no evidence that the virus is transmitted by paper, money, packages, even during the peak when a lot of people were washing the letters that came in the mailboxes. I think there was a really elegant study that was done at one of the universities looking at the ability to isolate the virus from these surfaces. So that's certainly not the case. Because of contact, the school, with its facilities management, has an aggressive program to clean what we consider to be high contact surfaces. So in the schools, they're cleaning the desks, they're cleaning the doorknobs, even in the government center, several times a day, someone comes through and she's cleaning my door handles, and they're doing that throughout the entire building. So we're focusing on high contact areas. But these high contact areas don't get contaminated as heavily if we wash our hands and sanitize our hands. So by washing your hands and sanitizing your hands, you're reducing the viral burden in the environment as well. So as a parent, I would not be concerned about the cleaning. I think, the cleaning that's being done in the school is appropriate. And in the city buildings, it's certainly appropriate. Should you be concerned about paper? I would not say necessarily so. And it again varies by the age of the child. If we're looking at daycare centers, for example, where there's a lot of hand-to-mouth contact and children are not able to clean their hands as effectively as, let's say, high school children, there are certain recommendations from the Office of Early Childhood Education where children need to have some tactile activity in very young children. So they'll say, assign each child their own little basket to play with or their own little set of books. So we take additional steps to do that in our early childhood in our daycares and those types of facilities. So, in terms of how long, there's still a lot of studies. I think the last time I looked at this, when early in the peak, they were saying maybe 7 hours it survives on surfaces, up to 4 hours, but we're cleaning the surfaces in schools and children are assigned to their desks.
Okay, so I want to quickly thank everyone for joining us. Dr. Fernandez, thank you so much for reading questions for us this evening. I really appreciate the support again that we get from our city official and also all of our health professionals. I do think that this would be beneficial, that moving forward as more questions come up that we may host more of these. And so I hope that you learned a lot this evening. You know that you can always reach out to the health department or the school district if you have any questions. Have a wonderful evening, stay safe and stay healthy.